here. We got 3 full days of fabulous content. As you can see, I got a lot of energy. My name's Rachel Muleman. I run a company called the Biz Advisors in town. I've been here for 14 years. Anyone, any idea where I'm from before those 14 years? Oh, someone talked to me earlier. Someone talked to me, or they just happen to know New York? Very well. 4th generation American, New York City. It's a pleasure to be here with you this morning. I absolutely adore the health industry because without health, we're not surviving very long. So we have one of the most poignant topics and discussions here in this room, making history because we have the people like you in the audience. So I want to first thank you for joining us at the Intercontinental Dubai Festival City. This is a great venue. As you probably know, we have a lot of events going on. This is the second time we do this event each year, and it's really, really exciting because it brings people together from all over the globe. And as I get into the audience and see who is here, we're going to hear where people traveled from, what they're doing, and how they're making an impact in the health industry today. So we are streaming live on YouTube. So if any of your family, friends, or colleagues want to see your panel, your topic, your conversation, or even some of the opportunities where you will be receiving some awards and recognition, YouTube is a great place to start. So I'm going to give you all that information. So I'm going to be with you for 3 days to give you everything you need to make this as fun and informative as possible. How's that sound? Okay? Great. From a show of hands, who's on social media? Everyone on social media in this room? Everyone's using the phone, right? Okay, great. Show of hands, who's on Twitter? Okay, wow, amazing. Who's on Facebook? Anyone on Facebook? All right. Who's posting on Facebook? Who's just looking at the pictures of all their friends on Facebook, right? Okay, who's on LinkedIn? All right, this is my favorite platform because at the end of this event, I want you each to build your personal brand and connections professionally. And there's no better way to do it than LinkedIn. It's the only platform that has succeeded in connecting all these professional people. So I'm going to be reminding you how to do it, how to use it, and how to maximize your personal brand while you're at Health 2.0. Okay? We do have a hashtag called Health2Conf. It's too long to write conference, so they just wrote CONF, hashtag Health2Conf on all the platforms. They're on Instagram, Facebook, they're on YouTube, they're on everything except Snapchat and TikTok. Any TikTok? Oh, we got one. Snapchat? Not one yet. Okay, great. Okay, we're talking to the right demographic here. So I highly recommend if you find someone on stage valuable and their content incredibly inspiring, take a picture of them, post it on your LinkedIn profile or any other profile, hashtag the event, and then the event organizers will find you and reshare. This is a great way for other people to know us. So we all are here to grow professionally, right? Raise your hand if you're here to meet professional connections. Absolutely. Who's here to make some business connections? Great. Okay, so the only way we're going to maximize is not only here live, which is great to do after COVID, right? We're going to meet people, but online digitally, there's a lot of people to meet. So if you can, and if you have any questions, please allow me to support you in growing your personal brand digitally during the next 3 days, okay? So we have dedicated researchers, policymakers, forward-thinking organizations and businesses here that are all coming to do groundbreaking work in the health industry. I'm really excited to share all their efforts. There's so much effort needed to really make an impact in the health industry and to affect people's lives around the globe. So I, first of all, applaud you. I want to give you applause, just myself, for amazing work in this amazing field. And we're going to recognize you guys in the next couple days. I'd like to also express my deepest gratitude. We have a silver sponsor, Burjeel Hospital in Abu Dhabi. which has made it possible. Where are you guys? Raise your hands. Oh, yeah, the bad boys in the back. I got it. I love your hospital. Fantastic hospital. Great, great, great reputation in town. They're doing incredible things, and we wouldn't be here without them. So thank you so much for your participation. Thank you again. We're going to hear more from them. Welcome. Keep on coming in. Okay, people are going to come throughout the day. You see there's a lot of empty chairs still, and I saw hundreds of badges just waiting to come on in. So as people are getting up in this town, we'll be inviting them in. So as I mentioned, phones, please do me a favor, 2 seconds, just put it on vibrate. I know everyone's multitasking these days. Just put it on vibrate so no one's up here and all of a sudden the phone goes on. Take that minute. I'll give you a minute to do that. We have coffee available all day. The Intercontinental does a fabulous job giving croissants and a whole bunch of other additional food that you can enjoy. So if you haven't had any, you're welcome to bring it inside here, okay? Leave it anytime. If you have questions about where the restrooms are, they're right by the front. Very simple. We're gonna break for lunch. We're all gonna go downstairs, have a nice buffet meal together. You'll have the opportunity to meet some of the other professionals in the other rooms that are here. Again, 6 events happening at the same time. So without further ado, I'd like to invite to the stage our first panelist moderator who's going to be here to just guide us in the first topic of the day. It's a great way to start the day because it's all about collaboration, right? I think strategic partnerships and collaborating professionally is the way forward. So we're gonna find out how all these different people inside the health industry are going to connect and actually get engaged to be successful in all of their efforts. So can I invite to the stage the moderator, Pranay Garg, for the founder and MD of HealthCong. You see everyone has a catalog. Oh, give him a round of applause. He's right here ready to go. How are you doing? Welcome to the stage. I'm gonna give you a microphone.
Thanks.
Okay, this
Should be on. Hold on.
guy's microphone, please. Let's see, that one's gonna be for you.
Hello, yep.
Okay, I'm gonna let him announce everybody who's coming up to be on part of his panel for a good half an hour conversation. Everyone has a catalog, read along, see who these professionals are. It came in with your bag this morning when you checked in, and that's gonna be really informative to understand who's here and a great way to bring them into the conversation digitally. So without further ado, thank you very much, Pranay. It's all over to you.
Thank you very much, and good morning to all of you. I'd like by saying that alone we can do so little, but together we can do so much. And to get started, I'd like to invite Dr. Ajay Ganguly onto the stage as a participant. Reem Alkari, Karen Rosenstein, please. Well, we first start with a round of introductions, and I will have each one of them introduce themselves, what they do, and what they're here for. Thank you. Reem, you would like to go ahead?
Good morning, everybody. So I'm Reem Alkari. I'm the founder and CEO of 360 Smart Lingo. 360 Smart Lingo is a language service provider. We allow businesses to develop their global brand, and also we believe that communication is not only about language and rendering words, but rather rendering emotions, rendering cultures, and rendering everything that comes with it to understand something. So we provide language solutions like interpretation, translation, and localization. And yes, that's 360.
Good morning, everyone. I'm Dr. Ajay Ganguly. I'm the medical director at Muljibai Patel Urological Hospital in Gujarat in India. I've just joined them. I've had over 3 decades of experience in healthcare. I was in the Indian Army. I then worked in some hospitals in Bombay for about 7 years, and then with the Apollo Group in Hyderabad in India for about 5 years. A lot of experience of hospital operations, patient care, and I look forward to this conversation and, of course, interacting with all of y'all.
Hi, everyone. Let me start by saying that that's the first time for me speaking in a large audience, so I'm truly excited. Thank you all for coming. I'm Karen Rosenstein. I'm from Israel. What I do is basically I devoted my whole life in the past 3 years in order to provide a unique model. It's a technological emergency room. It's a unique model that provides high quality and time efficient care to remote places. So we provide health medicine, we provide fast blood tests, we have state-of-the-art imaging center, all of this basically because I truly believe that the basic right that every person have is the right to get a really high quality care as soon as possible because we never know when we're going to need it.
Absolutely fantastic. So fundamentally, thanks for the introduction. We're going to be looking at 3 different segments of how we are going to be building collaboration between patients, providers, and the equipment. And that's really when we start looking at what we've gone through in terms of the pandemic. We're sitting here post the pandemic. Nobody's untouched is what I would say. So first I'd like to put it across to a clinician who is Dr. Ajay Ganguly in talking about sort of a overview and challenges as far as the healthcare industry is concerned, more from a clinician's perspective. Dr. Ajay Ganguly.
Thank you. As you're all aware, healthcare is an extremely complex work environment. We have different stakeholders. I think the first time somebody actually spoke about the stakeholders in healthcare was Donna Bedian from the University of Chicago, who in the 1960s took up a study on health outcomes and spoke about the various stakeholders. And he spoke about the hospital management, he spoke about the clinical providers, and he spoke about the patients. Each one of us brings their own perspectives, their own biases, their own cultural aspects into this mix. And it's important that all these are dealt with. Obviously, collaboration is the key here. And this is what actually will bring about a great outcome for a patient.
Yeah, great. So given the focus on patient centricity, I'd like to now have Reem give her views on the emotional connect, the element of trust, and what is the perspective from a patient's side.
Thank you. So I'm a former clinical pharmacist and a former medical interpreter. And by that, and also a former patient. So everyone here was a patient, hopefully never again, but you were a patient at some point. I wish that you have never had this encounter of being a patient in a foreign country that you don't speak their language. This is where actually the pain manifested for me. I'm an expat living abroad in a country that I don't speak the language. Living there during the pandemic, even pre-pandemic, I got sick. I went to a hospital. I want to be treated, but no one speaks the language. No one speaks my English. No one speaks Arabic. This is my mother tongue, so I couldn't communicate, and that's where it started. I can't understand what's going on. I'm a room full of doctors here, and I know that at least 50% of this audience has experienced that as doctors or as patients. Having the inability to communicate as a patient is frustrating. You're sick, that's frustrating, but not being able to understand or communicate what you're going through is too. So what I'm trying to say is, pre-pandemic, telehealth wasn't as prominent as it is now. During the pandemic, telehealth has accelerated. We have seen a shift in the healthcare services from in-person, to a more remote format. And for me, it is still picking up. This also consequently increased the demand for consecutive medical interpreters. A trained medical interpreter is someone who will be able to convey the communication properly. So if I'm sick and if I'm frustrated, I want my doctor to know that I'm sick and I'm frustrated, not only that I have a stomach ache, because maybe my agitation is a symptom, or maybe not. So this is the communication is the key for doctors to understand what we're going through. So
Yep. Thanks, Reem.
tell me, thank you.
And I'd like sort of Karen now to come in with a personal story, which is going to be accentuating what Reem brought out on how she went through, from a patient's perspective, the gaps she found, the challenges she faced, to talk a little about your own story, as well as why you are in the business right now. Yeah?
Well, I used to work at the Israeli parliament. I used to write speeches and I was a spokesperson. I wanted to be the Minister of Welfare, as naive as it sounds, I know. But a few years ago, I had 6 cardiac events. My heart was 230. So, and I've done nothing. So if you think about it, a person, when he runs a marathon, his heart is 170 when he runs. I just sat and I had 230. So my family and I immediately realized that something is completely wrong. Like, you can actually see my heart through my shirt. I couldn't breathe. That's how I said yes, and that's how I said no, because I couldn't say the words. They rushed me to a hospital. Luckily, I live close to Sheba Hospital, which is the best ninth hospital in the world. And over there, they inject me adenosine, which stops the heart for 6 seconds. I'm sure all of you guys are aware of that. So my heart went from 230 to 0 to 90 in less than a minute. I was just terrified. So for 2 years, I was scared to leave my home, because what I will do if it will happen again. That made me realize that I looked at what I had, and I had a arrhythmia problem. So 50% of the population in the whole world, every one of us, I'm sorry to be the one to say that, but 50% of the people here will or had or will have an arrhythmia problem. It can be really easy. The majority of us won't even know that, but I had a pretty severe problem. So if 50% of the population will suffer from that, and it can happen at any point in our lives, what do people do when they're not lucky enough to live close to a hospital or to a good hospital? So it can happen at any age. People can have 200 in their heart rate, and they can be in their 60s, 70s, 80s. All of us in our own countries suffer from difference between the center of the country and in the outskirts. So I can tell you that in Israel, in the north, there's people that suffer from a problem. They have to drive for an hour and a half to the nearest hospital. And unfortunately, that hospital won't be good enough. So if you're lucky enough to survive an hour and a half, you might not be lucky enough to get the best treatment. And from my own experience, knowing how terrifying it is, I thought to myself,
Karen, Reem's got a question for you.
yeah, sure.
Yeah, I actually, since I was talking about telehealth, don't you think that telehealth contributes to the solution more than having a technological emergency room? Wouldn't it be more convenient for me to get a telehealth service? It will be faster, more efficient, a trained person, a companion to be with me at my home to handle my emergency if I have a recurrent emergency. What's your take on that?
Well, it's a good question. I struggle with that on a daily basis, because I think, especially in health field, there are some things that can never change. The look in a doctor's eyes. When a young mom has a child and that child is 1 year old, she doesn't want through telemedicine. She wants the doctor to actually feel the heart, to look at the kid's throat.
Great perspective. So we've heard the doctor, we've heard the patient, and now we've got to be hearing about the equipment. Let me take that upon myself a little. And so I've got to flip the moderator's role onto something that I can do as well. So what we've now realized is the doctor is where he is. There is a patient at the center of it. The patient has a problem of language barriers, access barriers, and bridging this little gap between the doctor and the patient. And that's what we've seen now is the increasing need for point-of-care devices. That's really where equipment comes in. Well, the hospital equipment is where it is, but it's as long as the patient can be sort of subjected to that kind of a diagnosis. But point-of-care diagnostics is something that we see coming to the fore, a kind of a enhanced need for point-of-care devices. What can these devices do? How simple can the user experience be? Because when we're outside the hospital environment, it could be community health workers, it could be health supervisors, may not be nurses, or caregivers basically. And that is with limited expertise. So your user experience has to be getting as much as possible, platinum 10 minutes, golden hour, or whatever you call it, to save a life. So that's really where we find that if the care has to move away from the hospital or bridge that little gap between reaching the hospital and being cared for, that is really where I think challenges lie and solutions need to be sort of brought to the fore. Yes. Now that we talked about challenges, I think I'll take a minute and move across to digital transformation, because digital transformation is something that has raised its head pre to post-pandemic. When we talk about technology is not about, it's about people. It's not about tech per se, and it's not toys for boys, as we would call it in the Air Force. But coming back to digital transformation, I'd like to kind of push it across to Dr. Ganguly once again to give his perspective on this very aspect of care and care delivery.
Thank you. As you're all aware, technology in all industries has been advancing at a tremendously rapid pace, and healthcare is no exception to this. The kind of devices that are coming up, and particularly patient monitoring devices, have advanced tremendously rapidly, and particularly I think in the pandemic, what we are now calling as point-of-care devices, is something that has gone through the roof. I think with some of them, there is an issue of trust or possibly validation on the reports. So particularly monitoring devices, there is a little, from a lot of clinicians, we do have a little lack of trust on the actual figures that are relayed back to us. The other thing is, during the pandemic, of course, we all know telehealth and telemedicine was such a fantastic innovation that provided access to people everywhere. Subsequently, we come back to that earlier saying, I think we spoke about the fact that healthcare is personal. At the end of the day, no matter what you do, it is something that is extremely personal, affects, as she just said, you want the doctor to look at your child, or you want somebody to actually physically see. And that is something that is starting to come back. A lot of clinicians do tend to feel that they actually can get a connect with the patient if they see the patient in person, not as a virtual meeting.
But doctor, allow me to ask you a question here. I understand the connection. I have a personal story towards that connection, but don't you think that telehealth has solved a problem that has manifested during the pandemic, which is the safety of the medical staff for unnecessary encounters? I don't need to be with the patient if it's not a necessity, an absolute necessity, and pandemic has proven that. We don't need another pandemic on our hand. So I understand the connection. It's really important. It's really important to see the doctor, and the doctor sees me, but not as important as the safety of the medical staff and the patients.
Interacting with patients, of course, will bring some risks for staff. I mean, there's no getting past that. Obviously, there's an element of training. So staff do need to be trained to make sure that a communicable disease transmission does not happen in a standard OPD encounter. The key to actually dealing with that is, of course, training of staff. But coming back to the telemedicine and virtual consults, the real plus point for me actually is that it ensures access for patients. you ultimately have to get in touch to do something. But the access is something that is a real boon, and this is something I think that is what I feel is a game changer for people across the world. At least your first access can happen immediately.
Absolutely agree with you, Dr. Ganguly. And while you asked him the question, I think now I'll flip it over to you because he ended with a queue of access.
Yes.
And what Reem brought out in her introductory remarks was that clear access, that enabling access through both language as well as trust. So you want to talk a little about? Sorry, I'm sorry. I'm terribly sorry. So I just flip it over because Dr. Ganguly ended with a cue on access, and Reem has been talking about access, how language barriers sort of do not efficiently enable access. So Reem, you want to talk a little about digital transformation from your perspective?
Of course. So digital transformation has improved the quality of medical interpretation. During the pandemic and post, the boost in the digital transformation has boosted the performance of an interpreter. And the medical interpreter is someone doctors and patients tend to oversee in the encounter. They are there, they are the reason you're communicating, but you don't give them, I'm not gonna say generally, but most of the time, they are not in the picture. So video remote interpretation has also improved that. If now me as an interpreter, I can see the physical cues of a patient, I can convey more. As I said in my introduction, communication is not only about language, me rendering a word from a language to the other, but also conveying the emotions and conveying the culture. So a motion with a hand could be offensive in a culture, but it's not offensive in another. An interpreter is the one who bridges that gap. So being a former medical interpreter myself, I always wanted the doctors to acknowledge that, please understand that I'm not an AI, I'm not a machine translator, and I have to take my time to understand what you're talking about. I have to inquire. Doctors or patients get frustrated when you say something or you ask for a lot of clarifications. But I need to facilitate this communication.
Great opportunity for you to speak a little about yourself, your pain, and why you really got motivated to get here. A personal story, I think, would really mean a lot.
Of course. So the reason I started my business is because I live as an expat, as I said, and I don't speak the language of this country that I live in. In the first month I moved there, I got really sick. I was admitted to a hospital. I didn't speak the language. I needed an interpreter. It was really late at night. No interpreter was available. But when the interpreter actually finally showed up, the doctor and the interpreter spoke for 10 minutes. And then they looked at me and said, "You're fine after 10 minutes. It's gonna be okay." I kid you not, because I am from a medical background. I'm a clinical pharmacist, so I understand some medicine. Clinical pharmacists, we're good. So I pulled up my chart and I looked at the lab results that just came in, and I realized I was actually having a miscarriage. And I've been bleeding for 2 days and I didn't know. So at that point, I said, no, this got to change. This country, in the US, language access is a right. It's a law, it's a legislation. But in other places in the world, it's not. And as 360, actually, our vision is to make language access a global right. Because if I cannot communicate what I'm going through to my doctor, and my doctor cannot reassure me, be it physically or telehealth, I'm not gonna be able to pass this emotional and mental distress that I'm going through. So that's
great. And I kind of completely relate in terms of not having access, because while you have the doctor and the patient together and you're not able to communicate, that is a barrier.
Yes.
You want to talk a little about the barrier or the event that you went through in your personal life and what motivates you in this particular time in terms of bringing innovations to health, Karen?
Yeah, sure. I feel like for me, understanding that the health field, as everyone here knows, is really static. It doesn't change a lot. And what COVID showed us, by the way, I think fintech and transportation changed so much in the past years, but for some reason, we at the health field stay really static. I think what COVID showed us, COVID just accelerate an inevitable process that will have happened no matter what. I think we all understand that new challenges will always come every few years, and we need to be better prepared than we used to be. So, speaking about telemedicine, yeah, for us, our model is to be really efficient, not letting people wait in the waiting room where they're exposed to germs. Waiting for days and sometimes months to see a physician to consult with. So, or a blood test, they can wait for hours. So what we do, how we implement technology in our technological emergency room is basically a patient come to us, he or she sees a doctor, they get really fast blood tests. We have two, we have MIMED or SITE, I'm not sure everyone is aware of that, but these are two blood tests that can provide answers between 10 to 15 minutes. They can tell you if you have bacteria or you have something viral. And also to measure everything you need to know in your blood test. If you need to consult cardiology or any kind of field, you can do it by telemedicine. At that point, you can actually consult with everyone. We have the best people, the best professors to do so. And if someone needs to have their CT scan or any kind of imaging test, they can do it on the spot.
I'll pick it up from here, because what I hear from you is while you're there, what you want is quick access and effective, quick case taking in terms of what is the prognosis, diagnostics, what we can do to be able to move the patient into the continuum. So from a perspective of, I spoke about point-of-care devices, and I spoke about communication as well. So pulling all of that together, so what I think we need at the point of care, outside, before I can reach Dr. Ganguly, is to be able to converge in terms of communication, in terms of information that is being passed on to the doctor, and to be able to interact between the interaction between the doctor and the patient, be it remote. We talk about remote patient monitoring today as one of these trends that are coming in now, post-pandemic. So the equipment that we talk about has to be, portable, extremely portable, accurate, and you talked about language barriers. So a little more use of iconography, where the community health worker who's not considered to be at the level of a nurse, but can understand icons, use her or his mobile phone, which is connected, to be able to screen and automatically send the updates to the electronic health records or the EMRs. So we talk about equipment which can be connected with your phones. We talk about Bluetooth, we talk about Wi-Fi, which can easily be operated within a low or a no bandwidth kind of environment. Because today, in the developing nations, when we talk about base of pyramid, we do talk about fundamental enablements like a 2G signal or 3G signal. We talk about 5G, but that's much later. But if we can communicate, if we can screen patients, and then update this so that the doctor can see remotely. And then, of course, there is a video interface, there's EKG or ECG interface, there's trends available. All of that, the doctor can effectively at least guide the care provider or caregiver at the point of care to be able to save that life during the first 10 minutes or the first hour. So that's really where I see digital transformation transforming care delivery at the last mile. As far as the digital transformation across hospitals, across equipment is concerned, that is for the big corporates to do. But innovation perspective, from innovation per se, needs to come in outside of the hospital towards underserved communities. That's my point of view.
Yes.
And that being said, unless you guys want to challenge me, I'd
Actually, no, I just want to add also that telehealth has improved the quality of care that the mobility impaired patients are receiving. Mobility impaired patients, they existed pre-pandemic, but they weren't able to get the care. As like a massive increase in their quality of care has been reported post-pandemic, and that's because of telehealth.
we got out of it and
Yeah.
we're sitting in the conference, so
Yeah.
very good. So now we come to the last part before we conclude, and I'm sure there's going to be people going to be telling me about the time here. So we now want to talk about the importance of collaboration. We talked about the challenges, we talked about digital transformation. And now I'd like to hear Dr. Ajay's perspective on collaboration. There have been questions, there have been challenges.
And we're
but
all
I'm
trying to
sure
work towards making your life easier, so.
we can bring it together to be able to sort of create impact, improve the patient experience. And that's really what matters, is what I think. So, Dr. Ajay.
It's really interesting and important to understand the way health has transformed from interaction between a doctor and a patient to a healthcare team and a patient. It's no longer really one person doing something. You got the diagnostic services, you have the other paramedical workers, and invariably there are multiple doctors who are generally treating every patient. Obviously, with this, what happens is the concept of collaboration, because it is a multidisciplinary system which is treating a patient. It's again very critical to understand the difference between a multidisciplinary and an interdisciplinary. Multidisciplinary, we're talking of multiple teams involved, but the decision making is possibly likely to be with one person or with one department. Interdisciplinary, where each department is doing their bit to make the patient better. This does create a little bit of a legal issue because at the end of the day, very often it's one department or one person who is responsible for the care of that patient. This, I think, is a discussion for another day because each country has its own take on how this happens. But the take-home message from this is that since there are so many departments or teams and people involved in care, collaboration between them is key to making sure that the outcome is good and the patient goes home happy.
Absolutely, I absolutely agree with you, and thanks for your perspective. So that's really what we want to take forward. So, Reem, you want to talk a little about your perspective on collaboration?
I couldn't agree more with Dr. Ajay. It's at the end of the day, we are shifting towards, there's a paradigm shift towards a patient-centric. It has always been a patient-centric, but the pandemic has opened our eyes so much that healthcare, as Karen said in the beginning, cannot just stay an offline hospital, a patient coming in, going out, and that's it. Every day, every minute, every second, there's a lot of patients. And there's a lot of patients with with a wide spectrum of problems, from the mobility impaired to the language limited proficients, to people who are with disabilities, to people who have speech also impairment. Speech impaired people are facing a lot of problems, even using interpretation, and they need, in the same language. Interpretation is not about from one language to the other. It could be from a dialect in the language to the other. It could be from a problem to the other. It could be ASM, like sign language. There's a lot of types of interpretation in the medical sector and other sectors too. So this is where we come in, technology comes in. This is where the digital transformation comes in. I've recently heard about an innovation. Someone is trying to create an interpretation AI to actually help these stuttering patients. It's an AI that interprets from stutter to regular speech so they can communicate more effectively. And since that shift in the mindset of people that healthcare now has to be an innovative, and not only innovative in clinical trials and this and that, but in technology, I believe the patient is reaping all the benefits at this moment.
Fantastic. Could you talk a little about the solutions that you have, given the pain that you've gone through a little about your solutions that you brought to the impacted people?
As 360, as I said, we are a language solution provider. So as a language solution provider, we offer any linguistic abilities, not only to the medical sector. I'm here as in the health conference, so I have to talk about medicine, but we actually do help also businesses because the communication doesn't know a sector or a vertical or a domain. It's in everywhere. This is our day-to-day. We talk for a living, most of us, so we need that. We offer this medical. We offer this interpretation, consecutive, simultaneous, whisper, any type of interpretation, basically, in any domain. During the pandemic, also, the remote simultaneous interpretation has picked up its need. Conferences were all now online. Now the borders are becoming just a line on a map. Like it's a globe.
It's that much.
It's that much, exactly, So it's just a line, You could be here attending a conference in San Francisco. Someone here was from San Francisco, I heard. Yeah, hello. So I could be attending a conference at this moment from San Francisco without any problem, and or in Japan or in China, and I don't speak their language. RSI technology has improved that I can just tap into that conference and now hear it live in my own language.
Awesome. So it's all about collaboration. I'm sure she's brought out a perspective. There's plenty in the audience who would like to kind of catch up with you and the work that you've done. I understand that there is trust and vulnerability from what Dr. Ajay and you have brought out. Talk a little about collaboration from a trust and vulnerability of the patient perspective, Karen.
Thank you. I think in matter of collaboration, first of all, there has to be trust, right? But I guess I heard there's a lot of representative from different hospitals here in the crowd, so I do want to convey this message. In terms of economic models and the way we will see how the medical field will run in the future is only through collaborations. I guess that in everything that has to do with health, we're really conservative, especially hospitals. And hospitals needs to know that at the end of the day, we all have the same incentive, right? We all want to provide good care for patient. We all cherish and understand how crucial it is and how fragile our lives is. So I guess if you guys have to take something from this panel, please take this. Be more open to collaborations. I met so many CEOs of different hospitals in the past 3 years, and everyone say, yes, we understand, but honestly, no one actually willing to be open-minded. What we did in the past 3 years is we took one of the best hospitals in the world, in the top 10, and I was able to get them understand the importance of collaboration with technology. I researched so much about everything that the health ecosystem has to offer in terms of technology. We chose the best of the best, and we actually created a beta site. We have a beta site in the north, in the periphery, and we tried to learn from that. We developed a system that shows how crucial it is, that development. Once you have the support of a hospital and you have someone that actually done the research and know the best technologies, and there's no compromise in terms of the services, then just one last thing, then the patient, and that's what we all want, at the end of the day, will be happy and we can actually save lives. So the collaboration is crucial.
Fantastic perspective, and thank you very much. Quite an emotional appeal to the audience here. What we understand is there is a structure, but the structure is loose. We talked about hospital settings. We talked about ambulatory clinics. We talked about patient vulnerability. We talked about trust. But we also want to be talking about the gap, the care delivery gap in the last mile. We want to be talking about how we can bridge that little gap outside of hospitals through community health programs in a public health setting. So we definitely want to be focusing on that as well, because most of the developing nations, as brought out by the World Health Organization, there's 57 countries which we just passed the Universal Health Coverage Day on 12th of December. There's many billions of people who do not have access. We spoke about access. We talked about how we can reach the last mile. So collaboration has got to be starting from that point within communities. come into clinics, then come into hospitals. So there's a huge gap. And there's the basic pyramid still does not have basic access. So I appeal that we collaborate to be able to reach those, both from a preventive perspective or a curative perspective. So there's a lot that needs to be done. And while we sit in this August company, there's a lot of thinking people here. We definitely want to be appealing to them to be looking at the last mile and looking upwards. So with that, I think we'll come to a conclusion. There's been takeaways. There's been emotional appeals, which you guys have heard. So I think I will open it up for a Q&A session now. Is that okay now? Yeah. So you're welcome to ask your questions, address it to the panelist that you want the question to be answered by, and we are happy to be answering questions.
Round of applause, a great panelist. Come on, guys. Okay, cool. Thank you. A lot of information there. Collaboration is key. Collaboration is how you grow your business fast. And I want to open it up for people in the audience to start engaging. I'm here to light the fire to make sure everyone can. I see hands already going up. There's a microphone they put in the middle of the room. If you don't mind just getting up and coming on up to the microphone, I want to invite you to move and be a little active. I mean, when we're talking health, you got to walk 10,000 steps a day, and I want to get you there to be more healthier during the next 3 days, okay? So come on up. Ask your question on the mic. Good morning.
Yes, good morning, everyone. I want to congratulate you. It was excellent panel. My name is Dr. Ludmila Schaefer, and I'm a medical oncologist. So I see patients every day, and thank you for doing this. One obstacle that we see is insurance. In the current healthcare, we have a lot of financial burden. And when we invite interpreter, first thing also we ask, what's covered by insurance? How is going to cost to the patient? Can you please share your perspective, or maybe we can hear internationally how we can help our patients? Thank you.
This is very true. One of the problems that people don't get language access for or communication access is because of insurance. I guess we should do better, but I honestly don't know how.
Dr. Ganguly is a CEO of a hospital. You want to share your views on it?
The financial burden of care is something that I think across the world is an issue. In our hospital, of course, since we do a lot of charity work, we generally tend to cater for the patient. Whatever shortfalls are there, we generally put in and manage. I think the WHO has been speaking about the financial coverage for patients, because obviously giving great care is a cost. And how to do that is something that is a struggle. A lot of countries are talking about it. Obviously, insurance or HMOs are one of the ways that it happens. They have their own constraints and on the limit to what they go. From a, I think, accessibility point of view, what we're looking at is 100% coverage for all people. I think as of now, that's still a goal to be achieved. It's something that we're not there yet.
Yeah. So
it is increasing. I think the WHO is estimating by 2050, they're likely to get more than 80% of the global population who will have some sort of coverage. And if that really happens, I think that's a fantastic step. I think it will obviously cover aspects which includes interpreters.
Would you want somebody from the audience to answer
I think
that?
we all want to hear whoever has the knowledge, right, to answer some of these questions that are going to be brought up today, right? So is there anyone in the audience, just show hands, if you have direct connection to insurance issues and concerns, payment processes, and how that actually you do. I got a hand back there. I'm going to come over to you or welcome you up. Come on, let's get those steps in and see how you can help answer this question. Yeah, please introduce yourself. We'd love to know who you are and help share some of your expertise.
Sure, thank you. I'm Jignesh Bhuta. I'm currently the COO of Smart Future. It's a health tech company based in Singapore, but I essentially have about more than 15, 18 years of experience in health insurance, different aspects of health insurance. So I thought probably this is kind of just relevant to kind of give my 2 cents. Fundamentally, there's a lot of negative connotation associated with the insurance coverage. And the sense is where the policy needs to pay, it doesn't really pay. One of the ways to tackle around this, and specifically for the question with regards to the translation, it's as simple as this. If you're able to demonstrate with the translation, A, better patient outcome, B, savings in cost, and C, the operational efficiency, the insurance or the third-party administrator of the insurance will actually cover it. And I've seen this model working in a couple of countries in Asia. It is not as smooth as one would like it to be, but it does engage a fair bit of communication. The positive point is, if today many stakeholders are open for kind of ideas and open to kind of willing to test what you're willing to promise. So in that sense, I think the future is hopeful. The future is bright. It just takes more communication in terms of just establishing this and get it covered under insurance.
Thank
Cover
you.
interpreters, please.
Sorry?
Cover interpretation, please. Have it.
Yes.
Please. It's not a luxury now, so please do that.
Absolutely.
I do also, if that's okay, just want to answer about, hey, physician for, I completely agree, and that can be extremely frustrating. I think that the answer relies in the fact that we need to change the economic model, and I think technology can do that. Technology can provide services that can cost less, and therefore all the HMOs can provide better services and cover more services for people who actually needs that. I personally, I work a lot with people from the health ministry to try to do exactly that. We try to build a model that will be extremely efficient so there can be more money to cover other treatment. I know every country is different, but I think we can all, once we implement technology and understand that that can be really, can save a lot of money, then the budget can go to people who actually need it to provide better services in other fields. And good luck, it is a struggle.
Yeah, I hope that answers Dr. Schaefer's question. Thank you very much. Any other questions?
Yeah, come on up. Come on. First one to the mic wins. That's how we're going to play this. Microphone, is it on?
Can you hear me?
There we go. We're ready.
First, my name is Dee Katz Shachar, and first of all, I want to say thank you very much. There was a very thought-evoking and provoking panel, really. So, like Karen, I come from Israel, and I have to say that we're very lucky. Also, like Dubai, the state really provides very, very good care. One thing that I noticed on myself is that I now tend to choose to see doctors online. Also for my daughter, also for myself, it's very easy. I go online, and I do want to address the issue as a public health promoter of digital orientation. The people who need the care most have trouble the most with internet and digital orientation, like I just said. So I think that not only covering interpreters, which is so crucial, and also in our country, we see, in Israel, we see that it is extremely crucial. It's the difference between life and death, interpreters. But also, it is crucial to teach people how to actually push the buttons on the most basic level. So if you have anything to add to that, I think that's also very important. Thank you.
Appreciate that, and appreciate that point of view. Thank you very much. Sorry, you want to say
No,
something?
I was saying actually you were talking about that. I believe that this is something that you are working on.
Yes, while I'm working on it, I'm hoping that this is being addressed globally as well in a public health setting. we spoke about how the community health worker would be at ease from a user experience perspective to be able to use the equipment on hand, to be able to kind of screen as well as medically help the patient within communities. Thank you so much.
I'll just add to that. Actually, the surprising burden is the switch that is happening now from communicable diseases to non-communicable diseases. And the cost impact of non-communicable diseases is actually much more. It's a longer treatment program and affects everything, right from the equipment and the treatment that is necessary. That's something I think as a global population we do need to look at.
Absolutely, and I see another question from Dr. Sora.
Yeah, I just, just want to say one thing. It's an amazing point. You're absolutely right. What we're trying to do is we actually provided a room that people that struggle with that technology, and there's so many people, whether it's a matter of education or age, then they can actually come to us. We have people that will put everything in front of them and then can sit in front of the TV and consult a doctor. But we also thinking about maybe providing hubs all over the country so people can come and get that assistant technology and consult a doctor. That's an amazing point. You're right.
That's the hub and spoke model, which is in vogue right now. Yeah, absolutely agree. Thank you.
Microphone, sorry about that. Hold on, it's not on. Mic, please. I'll try it again.
Good morning, Dr. Sural Rawas from the Sultanate of Oman. Thank you for a wonderful panel discussion about a very important topic. You mentioned some really good points about collaboration, and I wanted to highlight the point you mentioned about the economic model and to really advocate for value-based care. As you've mentioned, with universal health care, you have alignment of interests between the population and the healthcare providers, right, and the healthcare service industry in terms of everybody wants to cut low costs of care and have high value care. So how can the private practice industry benefit from the same thing? How can you have private partnerships with insurance companies to bring this value-based care model so that the economics bring alignment of interests and create win-win situations? And what I would love to see, one of the outcomes of this conference to be, is to see more collaboration between the insurance sector and private hospitals and really see how we can bring the value-based care model into the private healthcare, where the alignment of interests benefit the patient and the money being spent brings high value to the patient. And I think that will really help the digital transformation component by creating win-win scenarios. Thank you.
Absolutely agree, Dr. Sora. Good point.
Great.
Yeah, I think that was a statement more than a question. This is a call for what we should be doing.
Call to action, yeah.
Yeah, collaborate. The takeaway is the keyword, collaboration. Everyone should collaborate on everything for the best interest of the patient.
Absolutely agree.
For the future, we got another question coming up.
No, this is just a comment.
Okay.
My name is Sanjeev Sahani, and I'll change the prism now. I'll come from the equipment side of the topic. Between the suppliers, the providers, and the payers, there has to be a very strong integration. I've spent 40 years, and I got in about 4 to 5 new therapies in the country and the region. In 40 years, I have not seen technology has ever brought down the prices. It doesn't. Providers want to upgrade themselves and they want to get the best. It'll not get you profitability. It'll give you investments only. Suppliers have to research over the years to come with a new equipment. And insurance will not pay from their pockets. The challenge is still there. When we say value-based pricing, I think we have to treat the supplier community, the provider, and the payer who monetize together and see them as one entity and not as 3 entities. It is not easy to bring in the best technology at the cheapest prices and all 3 remain healthy. It is not.
So, yeah,
Thank you.
That's a great statement as well as a great learning coming from Mr. Sanjay of 40 years of experience. And believe you me, I share the pain as well, because like I said, while I am a veteran and otherwise a business person now into health and med tech, the one point that I want to bring out here is Collaboration actually, when you are, if you're talking supply, of course that's another question, but if I'm talking innovation, if you are breaking ground, then there is collaboration at the design, from a design phase. And when that design phase collaboration comes in, there is a clinician, there is a tech person, and then there's a business person. So I'm hoping that, and if your products and services are a solution or filling a gap, I definitely think that there is willingness to pay. Depends on who pays, that's a different question. But yes, value-based pricing is something that is definitely depends on the value that you bring in. And most of the players are the governments or the public-private partners. So
Thank you.
I'll just add on that. Actually, what he said again emphasizes the fact that non-communicable diseases are the ones where technology and equipment it's making a change, obviously, in the way things are being treated, but it comes at a cost because the equipment is expensive. I think somebody else spoke about efficiencies. So from private care, we are trying a lot of methods to make the whole service efficient, trying to reduce wastage. Of course, the drawback is that with the number of people involved and again, the fact that healthcare is personal, so each patient has something slightly different.
Absolutely.
So actually bringing a factory line system doesn't really work out. Ultimately, it does need to be customized for each patient. It's something of a challenge. You do need better equipment to treat patients, and that's something I think that is going to continue. I don't see change happening very quickly. It will need a lot of possibly government intervention to find some kind of solutions to this to make sure that it is accessible for all.
Exactly. Thank you very much.
Thank you very much. And let's give them a round of applause. Final for our first panel of the day, talking about overcoming challenges. Thank you, guys. Well done. We're going to see some of these faces up here again in the next couple days, but I would like to invite you go back and take your seat as we continue our program. We are streaming live on YouTube, so if you haven't shared the link, you can find it on YouTube, Health 2.0. I see that someone's already posted on LinkedIn. I do want to recommend, come on. Oh, they're going to do a picture in the meantime. Who posted on LinkedIn? Where are you? Where are you over there? Okay, we got it. Make sure you're using that hashtag. Make sure you're following our page so that everyone else can see you. And